Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
if you see the tumors of the external nose. So in the tumors of the external nose, we have congenital, benign and malignant tumors. Congenital tumors can be dermoids, encephalocele, meningoencephalocele, gliomas or nasoalveolar cysts. If there are benign, we have rhinophymas, papilloma, hemangiomas, then pigmented nevus, then seborrheic keratitis, neurofibromas and tumor of the sweat glands. If it is malignant, we have basal cell carcinoma, squamous cell carcinoma and melanoma. But what is important here is first we have rhinophyma. So what is rhinophyma? Rhinophyma is in the nose there will be hypertrophy of the sebaceous glands. This is hypertrophy. Hypertrophy of the sebaceous glands occurs in the nose. There is hypertrophy. So because there is hypertrophy of the sebaceous glands occurs at the tip of the nose. Sebaceous glands. What are sebaceous glands? They are actually holocrine glands. So hypertrophy of sebaceous glands occurs, which are actually the holocrine glands. Okay. So this hypertrophy will occur. Then this is actually a benign condition, not a pre-malignant condition. And now it mainly occurs the middle-aged men. It occurs the middle-aged men, and there is a pink lobular mass is seen at the nose, at the external nose actually. How are you going to treat it? You will have to do a carbon dioxide laser should be put, and you can remove the bulk of the tumor. So this is how you do for rhinophyma. Then in the nose we also have squamous cell carcinoma. Squamous cell carcinoma is the second most common malignant tumor of the nose. Then what is the first most common? It is basal cell carcinoma. Basal cell carcinoma is the most common malignant tumor of the nose, which is involving the nasal skin. And the most important site of basal cell carcinoma is the tip of the nose, and in the ala of the nose you see the basal cell carcinoma. So these are the important tumors of the nose.
Thank you and thank you for watching.